Dr. Paul Williams.
The newest member of the Medical Mission Hall of Fame's class of 2015 has hit it out of the park as a medical missionary. Ironically, this young man, the now Dr. Paul Williams, had no idea that he would become a physician and used medicine and compassionate ministries as a way to express the love of Jesus to hurting people around the world. After all, no one in his immediate family, which consisted of Dad Ward, Mom Leora, and older siblings Mary Jo and John, had a background in medicine. Many of his relatives were pastors, Bible college professors, or missionaries, but none chose medicine as a way of sharing their faith. Paul was 14 when he was sitting around a campfire at a youth camp when he shared with others that he saw himself standing in the front row of a worship service with many dark-skinned people raising their hands in prayer. By the time he graduated from high school, he understood the vision was to include medicine. After graduating from high school, Paul's passion to help others was fueled by spending 2 summers working in Chicago and Los Angeles with Teen Challenge. He worked with those in extreme need, gangs, prostitutes, drug addicts, and the homeless. By the time he enrolled at what is now Evangel University in Springfield, Missouri, Paul was well on his way toward his goal. In fact, he became just the second Evangel grad to become a physician. At Evangel, Paul met an education major who had been born in a displaced persons camp in Cologne, Germany at the end of World War II. Sophia Komenko came to Ellis Island when she was 6 years old. Her mother, a prisoner of war, remarried after Sophia's father died from tuberculosis. In 1966, the now Sophia Demkowitz became Sophia Williams. Sophia joined Paul on his first medical mission trip in 1968, a 3-month adventure to Kampala, Uganda. Thus began a career which has taken the 2015 Medical Mission Hall of Fame inductee to more than 105 nations, having been involved with more than 200 medical mission and disaster relief efforts. On that first trip, Paul was told that missionary healthcare personnel considered providing medical services to be their job, and that nationals would do the witnessing. Our awardee found that unacceptable, vowing to make sure that any medical program or team that he would lead would be involved with personal ministry whenever possible. Paul proudly notes that he has seen tens of thousands receive Christ as their personal Savior through his medical missions. Paul's missionary work was put on hold following his graduation from medical school at Washington University in St. Louis. He began his internship and pediatric residency at William Beaumont Hospital in Royal Oak, Michigan. It was there that their first son, Jim, was born. A 2-year fellowship in neonatology at UCLA Harbor General followed, where he did research and had several studies published in scientific journals. During that time, daughter Debbie was born. Paul returned to Beaumont Hospital in 1974 and remained there for 5 years, adding son Joseph in that period. 1979 brought more change and a position as Associate Professor of Pediatrics at the University of South Florida in Tampa. And while Paul enjoyed the move, squeezing in short-term mission trips along the way, one thing kept gnawing at him, the desire to become a full-time missionary. In 1984, he made the move. The Assemblies of God decided they wanted an organized medical mission program within the denomination. Paul became its Director of Healthcare Ministries. This was Paul's first effort at organizing a mission team. The trip was to Paraguay. He didn't have a plan for organizing a team, but he surrounded himself with missionary veterans who lived and worked in the region where clinics were held. Those clinics were held in or near churches. It became his blueprint for success. Paul spent 10 years working for healthcare ministries. Healthcare professionals of many religious denominations joined his teams then and shared their faith with patients, which was a novel idea to many of them. Paul's missionary career met another bend in the road in 1993 when he went to the Christian Broadcasting Network and asked for the opportunity to talk about healthcare ministries on a 700 Club program. When they listened to what Paul had to say, he was invited by Pat Robertson to start a medical division for Operation Blessing, similar to what he had done for HCM. Paul's career took flight with Operation Blessing, quite literally. Operation Blessing developed a flying hospital using an L-1011 jumbo jet. The plane had a seating education section for 67 people, a surgical facility with 3 operating suites, 2 dental exam suites, an exam and procedure area, and a pre- and post-operative recovery area for 11. Paul took the flying hospital to places like El Salvador, the Ukraine, and Costa Rica. Operation Blessing also landed in Pakistan and Russia, sending teams wherever there was a need, many of which were catastrophic events. One of those trips was to Goma, Zaire, now Congo. There, Paul saw the need for collaboration among Christian organizations and medical missions. No one Christian organization had the size, finances, personnel, or knowledge to take over any one of the 3 or 4 major camps housing up to 500,000 people displaced by civil war. Paul's experience in Zaire led him to form International Healthcare Network in 1997, the organization he oversees to this day. International Healthcare Network works alongside other medical missionary groups, helping to put teams together. The neonatologists and IHN have responded to some of the world's most catastrophic disasters, including the 2004 Indian Ocean tsunami, the result of the 3rd largest earthquake ever recorded on a seismograph, one with the longest duration of faulting ever observed, one which triggered earthquakes as far away as Alaska. And 2013's Typhoon Yolanda, one of the strongest tropical cyclones ever recorded, one which devastated Southeast Asia, killing at least 6,300 in the Philippines alone. To understand the scope of IHN's work, Paul's team brought enough medications to the Philippines to serve 15,000 people. Paul's experience in disaster relief has led him to publish a book and a workbook for teams responding to crisis. When All Plans Fail is a step-by-step guide to preparing for disasters in the United States and around the world. Now based near Asheville, North Carolina, Paul and Sophia have another child, David, and 8 grandkids. Jim is a pastor and head of Habitat for Humanity in South Bend, Indiana. Debbie teaches English as a second language. Joseph has his doctorate in religion, and David works at a Christian retreat. Reflected in his children with decades of compassionate leadership for others, Paul has truly left his mark on our world. For his commitment to others, the Medical Mission Hall of Fame welcomes Dr. Paul Williams into the fold as a member of the class of 2015.